Hello and welcome to the latest episode of the Melbourne Athletic Development Podcast. Today we are actually very lucky to have one of our physios, Georgie Macdonald, with us. Thank you for coming on, Georgie.
Thanks for having me.
Today we brought Georgie on because we thought it would be really good actually to talk about women in sport and some of the issues that surround training, performance and injury, because Georgie, your background you can probably share with people, but you've worked both in AFLW, VFLW, you've worked in women's soccer as well, and you've got a bit of experience dealing with some of the nuanced injuries that seem to be plaguing particularly women's field sport. And we thought we'd pick your brain about it. And in preparation for this, you also brought up some really interesting stuff that you were talking about. It's an area of interest for you that you're developing your understanding on, managing some of the physio-related women's health items. Mm-hmm. So I think it's something really interesting to talk about. And as you know, and we spoke about it before, but like obviously coaching females at a really high level, it's something that I'm constantly trying to learn more about because obviously there are some nuances that you need to have when dealing with that population. So maybe actually we'll get you to share, like, what was your experience like working with some of the women's elite teams?
Yeah, look, I guess first of all, like I was mainly in men's sport actually for quite a while I was actually studying.
Yeah, true.
So women's sport is actually still quite new to me as well. Just working at Carlton this year in the VFLW.
And you were St Kilda before that, weren't you?
Yeah, I was at St Kilda
AFLW?
as in the AFLW program, and then moved across to Carlton this year. So yeah, I guess it was actually interesting because I had quite a lot to compare to coming straight out of
What was the contrast?
Local men's footy straight into an elite female environment, or working to be elite.
What was the contrast?
I don't know, I guess it's just like you're still dealing with similar sort of injuries, but I just had to really adapt to the nuances of working with female athletes as well, and like you're working with obviously very different bodies. And I think as well the challenge being is obviously we all know that, you know, AFL is still a new sport for females as well, so I feel like I just saw a lot more injuries than in men's sport. And then
So you noticed yourself that there were more injuries?
Yeah, for sure.
What do you think drives that? Do you think it's, as you said, the newness to it? Because obviously your background as well, for people who don't know, Georgie was quite an elite junior middle distance runner, and obviously you continue doing some training now. I know that you still run a little
somewhat,
bit.
Yeah.
Still running a few
Doing
times
one
a
leg in
week.
front of the other, yeah.
When's that marathon coming up, Georgie?
Oh, we'll get to that at the end.
But I know you obviously work with a lot of distance athletes generally as part of your work here.
Yeah.
So you know sport from lots of different realms. What specifically did you find was different about working in an AFL women's program versus, you know, the sport that you've experienced before?
I think for AFL women's, like, first of all, like, it's obviously a sport that hasn't been around for a while, so women haven't come from, especially the women I was working with, a lot of them have transferred from different sports and haven't been playing it for such a long time, so they're not just as conditioned to the skills and the tenacities of AFL, really.
Did that influence the allocation of training then too, in terms of what particular physical, psychological, technical elements were focused on in the female teams versus the male teams that you worked with?
Yeah, for sure. I mean, I feel like we had to, obviously, like, in terms of the structure of, like, different trainings and the actual volume that you're putting the girls through as well, like, so obviously you still want to make sure that they're ready for the demands of the sport. But, you know, especially for those that are just transferring into a completely new sport, like, you've kind of got to strip back the layers a bit, and definitely the amount of volume you're providing them as well is something that...
Do you think that's specific to football, or or women's football, or do you think that that's just, you know, like, generally you need to just be aware of any athlete coming into a new environment and knowing what kind of loads to put them under? Because my experience actually at times with athletes, female athletes in track running, is sometimes they can often do more volume than the men.
Yeah.
So
but I think that also is different, like, obviously something like track and field's a more controlled environment versus something like a contact sport. Like, I noticed as well, particularly one of the main things I think was a risk factor for women developing injuries was actually their inability to position their body in space.
The contact,
and absorb contact. And I feel like that in combination with, you know, being exposed to a relatively new sport and not having a lot of practice of the skills and whatnot, definitely doesn't help. So yeah, I think that was one thing I noticed as well, just actually because the skill level wasn't as high, that influenced the way they actually went about the game. And then
what were the main things you noticed?
Just like in tackles and things, like more so how to actually go about getting the ball, how to use your actual physical structure, like with, manning up on different people. I found that was one thing that I did notice.
Womening up on people.
Womening up, yeah, true. Women's podcast should really. So yeah, I think it's interesting. I feel like footy's one as well. Just it is obviously a really rough sport.
Yeah.
And I think it really working in the women's footy even exposed me to the brutality of that even more. Probably because I was on the ground more than I was with the men.
I was actually going to say it's a point I've never really thought about, but you talked about the physical contact, and for a lot of women playing AFL, they might be quite new to the sports, and they may not have participated in sports where there is that degree of contact. And actually thinking about the development of contact as you physically develop, like for instance, I played rugby growing up since I was 8, and so you go through the same group of people of the same age of going through physical development. And obviously associated that is changes in the magnitude of forces that you're exposed to.
Yeah.
And then also then how you actually deal with that defensively as well too. Because obviously a bigger someone gets, even if you are stronger yourself, you have to be cognizant of how you absorb that momentum in order to, one, try and be successful with the tackle, but mitigate harm to yourself. And yeah, it's something that how do you actually go about dealing with that then for someone who actually hasn't had exposure to contact? Is there specific things that you should be looking at or working on to make sure that they are effective at positioning themselves, both from a performance standpoint but also from an injury standpoint as well?
Yeah, I guess you've got to make sure that the girls are getting enough exposure to those sort of contacts in training, and actually making sure that the type of stuff you're doing in the gym as well is actually going to really set their tissue capacity up to be able to absorb that. I don't think it's necessarily rocket science. I think it's just
more of an exposure thing.
It's just more of an exposure thing. I think...
Was there a concerted effort with the players who maybe came from that transfer to okay, we need to push them to get more contacts or get used to this quickly, because, the player that had maybe come through the previous VFL structure or had been playing in AFL, I think, is it 6 or 8 seasons?
Yeah, 8 seasons, yeah.
Yeah, if they've played 6 seasons, it's well, they're pretty experienced. But someone who transferred from basketball to footy or something last year, are you kind of okay, this person needs a lot of exposure to this now? And as a medical team, are you guys talking about it being they're not used to it yet, we need to do more on this? Yeah,
I think it also just comes down to that player's profile and their actual physique and what sport they've come from as well. I think the body contact side of things is probably more related to their physical capacity, as opposed to obviously there's a high component of skills that's involved as well. But I think often those girls that are coming from something like soccer or basketball, it's usually they probably are chosen because they have got that athleticism that can really, I guess, replicate on the AFL field.
Yep.
So being good at soccer doesn't necessarily suggest you're going to be a gun AFL player.
Yeah, of course.
You might obviously have good hand-eye and good ball skills, but I think probably you are chosen because you maybe are, you do have those physical traits that could really set you up for AFL. So, yeah, I guess it's a hard one, because I think it's just going to take time as well to see this. Once girls have actually been playing it from a young age, it'll be interesting to see the way the program goes in the next 10 years.
Do you think that there's, you mentioned the physical traits, and I think obviously people would be aware of, people who are more athletic, running ability, or they're physically quite strong, they might play certain positions. But is there actually a psychological profile that you notice, especially going from the men to the women? Was it a similar kind of psychology of they're the kind of people bashing into people and tackling and all that kind of stuff? Or were they more similar to, some of your female mates that, I could imagine my mate playing, they would fit in here?
Yeah.
Or do they tend to be, they're footy people and footy people just crashing into people?
Yeah, it's really interesting you say that, because I feel I notice that a lot, especially in the women's program. Yeah, the
rough and tumble,
the rough and tough, they're in that sport for a reason. They're ready to get stuck into it. Whereas in the men, you don't really notice as much, because it's probably something you also expect a lot of those guys. So I feel going to women's footy, definitely, yeah, it was eye-opening to see a lot of them did have that mentality. And
is that mentality differ to the other athletes that you've dealt with? Like, I know obviously you've been involved a lot with particularly middle distance runners and some very elite middle distance runners. I know you've got friends that are very elite.
Yeah.
Is that mentality different? Do you see, or do they have similar traits, and what traits, if they do have, are similar?
Yeah, I mean, I think something like an individual sport as well, I've noticed just working and obviously playing both team and individual sports. Like, I think, I mean, you can probably talk about this more than me, but like definitely...
You're the guest, mate. We want your opinion.
We're sick of hearing about
I don't shut
sick of
the
hearing my
hell
own voice already. I don't know, I think individual sports attracts, correct me if, you disagree, but a certain type of personality. I feel like those that are a little bit more self-disciplined, because a lot of
themselves.
Yeah, there's probably a little bit of that as well.
Wait, there's no egos in team sports
obviously
at all.
Depends on the person.
Self-absorbed, is that what you're trying to say, Georgie?
Well, yeah, I'm sure there's a bit of that. I probably had that as well. But I feel like in a team sport, there's a bit more room for that sort of like, camaraderie and like that sort of free-flowing chat in the club room, where it doesn't feel it maybe as professional as when you're in the core room by yourself in an individual sport.
Yeah.
I don't know. I feel like I definitely notice some key differences working from like in athletics and myself personally, and then also in footy.
What were those things? What were the things you noticed? And like obviously both of them are pretty elite. So what are the traits that you see different? And then I'll ask you the question, because obviously we want to talk about women in sport, like how that differs to maybe some of the more elite males that you've dealt with in injury environments and things.
I don't know if it's just because AFLW is still quite new, but I didn't find it as professional as track and field. Like, even though it was still
They're not going to like that, mate.
Well, obviously the professionalism was definitely like better than like local for sure. You would notice the difference, but compared to maybe like the same level in athletics. And I don't know if that's just the time that the sport's been around for women.
So should I write on the board athletics 1, footy 0?
Sorry, shout out to AFLW out here.
Why do you think that's the case? Do you think because there's a lot of athletes who are exposed to a new environment that they're unfamiliar with? Is that one of the things? Or
I think in individual sport you kind of have to probably be a bit more disciplined, because it's all on you. So you kind of can't afford to sort of take the backseat sometimes. Whereas I feel like some girls in team sports, like particularly in footy, like if it wasn't their day, they'd, you could tell like if they're having a bad day, they may not be training as hard, or like you can kind of hide on the field a bit, might just stick to do some skills and may not lift your intensity.
I don't think that's just a female thing. I think guys in team sports are the same. Yeah. If they're not having a good one, they're just having a sook.
Yeah, but I think that's a key difference between like
team sport
versus individual, for both genders. But whereas like on the track, like it's all on you, like all eyes on you. Like if you're having a bad day, if your time's on, it's very objective. You're either running the time or you're not. Or
that seems to be my observation of differences in team versus individual sports, is your ability to motivate yourself and your ability to overcome adversity alone.
Yeah.
Because, again, in team sports, you do have the energy and the dynamics of your team around you to actually get you up when you're down.
I'm sure it can be facilitative and also a detriment. Like, I think sometimes I think also I noticed it was a bit more relaxed sometimes in the team environment, like a bit more time for chitter-chatter between drills, and naturally that's just sort of what happens when you've got 30 other people around you wanting to catch up on, life and whatnot, whereas on the track or in other individual sports you don't really have that same opportunity. So that I think that could definitely change like sort of, the intensity. I don't know necessarily about the professionalism, but I think that definitely played a role.
And how does it differ between the males and females in terms of what you've noticed in terms of the traits or the approach?
Well, I think because this sport hasn't been around for as long, like a lot of women have probably gone into like an elite level of footy like quite early on into like their career. Like they might have only been playing footy for a few years.
Do you think that's a good thing or a bad thing?
I don't know. I think it's good that they're out, that we're taking it more seriously for women's sport in general. But for the actual player itself, I don't know. I think it could be definitely a detriment, like not taking yourself as professionally, like would definitely influence your performance. I do find that, I don't know, I think definitely for AFLW, I think it's just it's like obviously going to take a bit of time to really reach that full level. I think obviously the standard is like improving every year, which is great. There's more girls getting involved. It's becoming more popular from a younger age as well. So I think the sport will definitely, you know, change and for the better. But I think at the moment it's just hard because you're just working with a lot of new variables, and I think that definitely probably influences a lot of the girls, the way they take it seriously. Like some girls may not even played professional sport before this. So it's still very new to them and they're still trying to understand what professional sport looks like.
Yeah.
Whereas for men, like that have been playing, this has been one of the, you know, the more dominant sports for men in Australia, really, like more popular, sorry. So I feel like they've learned from a young age the skills and like what it takes to take footy to the next level, and they've had more time and exposure to do that. Whereas for women, it's like they're coming in and they're still trying to learn the game and also learn what it takes to be at that real elite level as well. I think that influences it.
A couple of questions I have. I imagine with the AFL women's team that you're working with there, you had a large variation of people pretty new to the sport starting at different ages, correct? Like from 18 to potentially like mid to late 20s.
30s.
Yeah, or even 30s.
Yeah.
Did you see a large variation then, or did you see a correlation between age and how quickly people adapted to the new sport?
I definitely feel like a lot of like the more senior girls in the team, definitely one were probably took it a bit more professionally, probably trained, you know, not, it's obviously dependent on the person, but probably like took training a little bit more seriously, and the intensity was definitely a lot higher versus the younger girls coming in. I didn't notice like a huge variability in terms of like the performance and whatnot, but I think definitely the mindset was something that I noticed. I think that's maybe just could be a maturity thing as well, not necessarily like, you know, reflective of males and females. It's just like just growing up, like as you get older. Yeah, that's just something that naturally. I was thinking
about like the actual development of the technical elements in particular, based on the age of the individual when they started. Thinking of, you know, there's that general belief of the younger the individual, the more neuroplasticity they have and the ability to adapt and develop new skill sets. Did you see that correlation when you look at some of the younger athletes you were working with compared to some of the older ones, if they were just beginning in the sport?
I didn't like necessarily observe that, like particularly. Maybe I wasn't as conscious of watching all the skills. About the injuries. I was more worried about like, are they all still out there, like not on the ground? I'm sure that's something that definitely would be there, but it's just a matter of I didn't necessarily see that. It's interesting. I feel like also just if they've been playing for longer, like sometimes it could be like any sport really. You sort of form movement patterns and like familiarity and the ways you like to play and stuff, and that can probably influence your ability to like change, I guess, and adapt to new changes. I think like when you're still quite new, you're probably more open to change as well. That probably comes with being younger in the sport, as well as obviously the neuroplasticity. But yeah. What
about based on what sport they came from? Like you mentioned before, you get a lot from basketball and soccer. Is that correct? Are there any other particular sports that you typically get transfer from? And when you're looking at people from different sports, did you see some had a more effective transfer of those skill sets or physical capacities they developed from that sport into AFL?
I definitely think like soccer and basketball are the two sort of predominant ones we saw. I think both are like, I think from a skills standpoint, like basketball and soccer are very similar in terms of like the structure. With something like AFL, like the sort of match play, your way to like work with the team, to like, you know, work with different spaces. A lot like the formulas and stuff are quite similar, and like I've played basketball myself as well. I feel like a lot of like the types of plays I saw in footy were very similar to like what I've seen in basketball, like, you know, whether it's offense or defense, you're doing things like zones. So I think like there's a lot of, in terms of like the structure of play, I think there's a lot of crossover. And then obviously like basketball and soccer being like other ball sports, you know, I think like the skills for something like soccer definitely are more transferable because it's
particularly with like kicking skills.
Yeah, correct. Yeah. And just like working on a field and like knowing how to work with the team in that sort of space. From like a physical structure, I think like basketball, like soccer not as, well, both are obviously like, you know, relatively not as much high contact, but there still is contact. Basketball especially, there's a lot of like similarities in terms of like the physical capacities that you need. Like you obviously need a lot of different like vertical, horizontal power, like the actual like intensity of the sport, similar, like it's a fast-paced game, not a lot of rest, not as much stop-start. So I think there is a lot of transferability there. Soccer's something I'm not as well versed in, so I probably can't speak as much from like a physical side of things, but there definitely would be a lot of crossover, yeah. Yeah.
What about then, and this is obviously something that's more relevant to your role in these sports, from an injury perspective then too, did you see any correlation between someone's sporting background with regards to injury prevalence, or did you see that varied really a lot?
Do you mean in terms of like whether they were they were more susceptible or they were coming from...
Like, as a silly example, basketball players, they all kept having hamstring strains, or the soccer players kept having groin injuries or something like that. Was there something that you, as a medical team, were aware of that, this person's come from here and we've noticed that they tend to get more of this? Or we
need to focus a bit more on their training in this element because they need to do more hamstring loading, whatever it may be?
Yeah, not so specific. Like when I was working at Carlton, I think it wasn't something we actually probably discussed enough, maybe. I think the
always a tough thing in these environments too is in terms of the amount of time and resources.
It's like you've got very quick time to screen through X amount of people. So I think it's probably something that we probably didn't have enough time to look into enough and make enough time to.
What about more broadly
as a medical team?
What about more broadly when you start to think about some of the testing you would do periodically and thinking about the correlation to certain capacities and injuries? Did you start to see certain patterns emerge from some of the data that you collected?
Definitely, like we had like a lot of obviously soft tissue pathologies, like a lot of muscle strains. We had a lot of ligament injuries. Like as we know, like the ACL rates in AFLW are like, very high across all clubs.
And like obviously, I don't expect you to have the answer because they're still trying to evolve that understanding. But do you have a bit of a theory on what's contributing to that?
Well, I think there's obviously the point of, we're not as conditioned for the sport as well. So preparing your body in space and also just physically, but also like, with women as well, like our hormone levels do influence our integrity of our soft tissue. So we are more susceptible as well to those sort of soft tissue pathologies. And I think if you don't have that...
Let's jump into that because I think that starts to go down a path that's interesting and it probably starts to discuss some of the cool things. And I know Jack's probably more versed on us on the histopathology of things. With the understanding of what happens from, the influence of, estrogen and progesterone and what effect that has on, say, collagen type structures, like what kind of things should people be aware of when they are working in that environment, Jack?
That hormones influence the stiffness properties of tissues is a really big one to understand.
I know you brought it up recently, just like the effect of different receptors on the actual structure.
Yeah,
can be influenced by different hormones, whether that be, we're talking, I think, more in the realm of inflammatory sort of receptors, but I think the same thing happens when it comes to particularly like, hormone profile.
Yeah, and look, I think the best example, putting it like an extreme, is thinking about pregnancy, because there are large hormonal changes associated with pregnancy to physically prepare the body for childbirth. And that's clearly an important thing to make sure that you mitigate potential problems associated with birth. And obviously too, when you think about the female menstrual cycle, there are hormonal fluctuations that are associated with susceptibility to injury, and we've talked a bit about this before when we spoke, particularly when we spoke with Adam Bryan about it, because he's certainly done some research in this area. And I know we've also spoken about this too, because even though that's something that you can monitor in terms of thinking about where an individual is within their menstrual cycle, you can't necessarily control that in terms of when they train or when they perform.
Here we go. Opening Pandora's box.
Well, it's not even opening Pandora's box. It's just a reality of the situation.
Georgie and I were arguing about this before.
Here we go.
It's a good lead-in. Thanks for opening. We didn't even...
I'll just step back now. My work is done.
I knew this can of worms was coming.
It was coming, but we didn't even prompt him, Georgie.
No, I didn't even know about this.
Thanks for entering the...
Thanks for entering the topic for us. All right.
Yeah.
You brought up the influence of menstrual cycle. And I think people are aware of, we've spoken about this before, that my personal opinion as someone who coaches female athletes at a high level is it's more something that you have to manage effectively and put in place plans ahead of time, and have risk mitigation kind of strategies in place, because it's not something you can necessarily choose the timing of. But there is another, process of thought and another argument. And you and I kind of went back and forth before. So do you want to maybe put that forward? Because I think you've probably got a little bit of experience of how that other side might work.
Well, I think it just comes down to the question of, obviously we know there's that whole concept around training around your menstrual cycle, and there's theories behind when you should be pushing the intensity more versus when you shouldn't. And sort of the general consensus is when, it's obviously not applicable to every female, everyone's different, but sort of off the average, when a woman's in their follicular phase, for instance, which is the first phase of your cycle, usually straight after your period, usually due to your hormone levels being a little bit lower, and you're not as tired from menstruating, you typically should have more energy, and you should be optimizing those times in your cycle to getting your harder training sessions in. So I think there is that whole theory about listening to your body, and what's the point of doing your PB session when you're at sort of your lowest energy point in that cycle. And that's something I've had discussions with, Tom from Strength and Conditioning here as well. Are we really going to be pushing someone in the gym and trying to see what their peak power is that day if they're middle of their period? And, obviously every woman's different, and some will have, it's all a spectrum. Some women won't really notice being on their period versus others that will really notice that energy deficit. And I was just sort of asking John, I was just saying to you, how do you go about it with your athletes? And I feel it's something, do you hold back on your training sessions if...
As I said to you, I don't think that it actually comes down to what the issue is. So for a female, it might be menstruation, but for a male, it might be, a migraine, or it might be they're coming off an illness, they've had a bad day at work, whatever it is, they haven't slept. And that can be male, female, it doesn't matter. You're always constantly monitoring someone's readiness to do what's prescribed, and the adjustments will happen based on that. Now, the reason to me doesn't really matter, right? So if a female athlete of mine says I've got quite bad period pain, I don't know that I'm going to be able to carry out the session.
Yeah.
You then start thinking through your options. Okay, what's our risk mitigation? Most of them pretty good. We obviously are very open. We talk about that stuff. Okay, have you taken some pain management? Are you doing certain things to help? There's certain things that often they find helpful. And typically, if you're someone, you mentioned you've had a few patients that, and even some of the players, they might have endometriosis, or they might have, PCOS.
Other gynecological issues.
Yeah,
for
that
sure.
they're very aware of. It's not like they're one day I went to play the grand final and I developed endometriosis. They know that they've got this issue. So they're consistently, you'd hope that you've got strategies in place, and that they've worked with, the professional they need to work with, whether it's a gynecologist or whoever it is, to actually put in place strategies. Because to me, I don't personally think that you can create, because I think there's a psychological component to it.
Yeah.
If you create a thing where anytime you don't feel good, you're going to make things easier for people, it sets you up for failure, but not in training, right? Because in training you can make it up, oh, my was hard today. But you get to the national titles, you get to a major... You don't have a choice
where you are in your cycle. And
yeah. The number of times too, and she'll probably fucking kill me for saying this, but, I coach my wife, and, the number of times it's happened where, because she's, the nerves are high, your adrenaline's high, her period's not meant to come on for 3 or 4 days after the competition, but it comes on early.
Yeah.
Right? And it's the morning of the comp, and she's like, fuck.
Yeah.
Right? You can't control that. You need to actually have strategies in place to manage it, because what are you going to do? Just drop your bundle and say I'm not going to be at my best today because I know that my hormone... You have to be able to transcend that. And that's, to me, that's not a gender-specific thing. It's I slept shit. I've got a cracking headache. I've got a major, I got the grand final, I got this game. What are you going to do? You're going to sit there and say, oh, coach, I can't go on the field because I've got a really bad headache, or are you going to find the best solution you can? Will you be perfect? No. But I think if you sell out and tell yourself like, oh, I'm not playing well today, then you're already behind the 8 ball.
I guess then, like, what about not at that elite level? Like, let's say just you're leisurely, healthy person. I think that's where it really applies.
I think you're answering it for everyone. I think that's the place where you can
really
be a little bit more, and it's weird because you'd say that that's more of almost like an advanced style of training, is being like very specific to
your cycle.
It's called like auto regulation training, right? But I actually think that only really works when you can kind of pick and choose the days you train and how you feel. And there's not many sports or events where you can do that because it's usually a pretty strict fixture or schedule to how it works. And if that's the case, you kind of have to get into those rhythms, whether you like it or not. You don't get a choice in that. But if you're someone who's like, oh, I go to the gym and I'm just trying to get stronger over time, right? And I'm doing it for health, or I'm a runner and I like running, or, you know, it's a more of a social interaction in terms of your sporting involvement, then I think you can maximize on the days you feel good, you push, and the days when, you know, your energy's a bit low for whatever reason, you might need to reel it back in.
But I also think there's also, regardless of elite or non-elite, like I think there is a place for still pushing yourself, like whether this is relative to the cycle, but just if you've got low energy that day, like I think about sessions when I just could not be asked doing anything, and how much more you get out of those sessions as well when you're really, like, I don't know.
I think too.
It's probably good to have not always be so regimented to your cycle, and there's sometimes, like, you know, obviously if you're, you know, very like low energy and you're not feeling up to it, that's totally a different story. But, you know, I think there is definitely a place for maybe challenging yourself in those periods.
There's two things we want to go on. Like, one, I'll say, like, have you ever had the experience where you go into a session and you're like, for whatever reason, you feel a bit crap, but it ends up being almost like a PB type session?
Yeah.
Or a PB race or whatever.
Yeah.
Have you had that experience?
Yeah, I have, for sure.
So, like, I think that's the first one, because as soon as you count yourself, maybe you're setting yourself for failure. But the second thing is, and this is probably more relevant, like, for women who, we hope there's some women listening, and we hope there's some people listening. What are some of the strategies, you know, as someone who has worked in that field, that, you know, and obviously you're not necessarily prescribing the medical side of things, but like for women who do have issues, particularly around their period and competing in sport or training, like what are some of the things that they can start to look into? I know that you've worked closely, obviously, with the team doctor and stuff like that.
Yeah.
What are some of the things that they can look at, whether it's, you know, a pain thing or whether it's other things they need to do? Are there strategies they can put in place? Because there's probably some women who go, oh, I just rule myself out because I feel crap on those days.
Yeah.
But like, I know that you would have dealt with this quite a bit. What's the kind of process that people should start to consider and go through?
Well, I think like it also very much comes down to the person and their profile and their health. But I think like for sure, like if it's really interfering with your training, like if your cycle, or, you know, let's say you've got a gynecological issue, whether it's PCOS or endo, I think the first step is actually, you're right, like you've got to find the strategies, and it starts by seeing a health professional that's actually experienced in this sort of realm. And I think definitely like often one of the first discussions I'll have with girls, if they do talk to me about their periods, I'll start to ask questions about, you know, what are your symptoms like? When are they coming on? Is it affecting your training? And if they're sort of ticking up those boxes of, you know, like I'm feeling really, like I can't train tonight. Like,
well, one of the ones that I get from a lot of my athletes, you know, they describe like either abdominal or back pain.
Yeah.
You know, like my back's really sore.
Yeah.
You know, my period's just started, that kind of thing. And when you're managing that, obviously as a musculoskeletal therapist, like what are the things that you're speaking to them about?
Well, I guess as well, like especially first things that I usually ask if they are noting like back or hip pain or something around that region is like, is it coming on in your period one? And if so, is the severity worse when it's on your period? Because that often is a good indicator that there is often, you know, something more internal and gynecological that maybe needs to be investigated versus if this is something that comes on at any stage in their cycle, a bit more sporadic. So I think it's just getting good at like screening people to know whether actually women's health input is going to be beneficial to this person. So if, you know, they are ticking those boxes, it's like, have you seen a gynecologist before? Have you heard of women's health physiotherapy? Like, are you even aware because a lot of women aren't even aware that's even on offer.
That's a massive one, isn't it? Because like, and it's probably not even, it's probably something that needs to be spoken about more by men as well. But I think for a lot of women, particularly even elite level females, and I'm shamelessly going to tell people that my wife roped me into watching SAS with Jana Pittman, but she's had 6 kids, I think, now.
Yeah.
Obviously, an elite level athlete in multiple sports, but she did this really hard obstacle course, and then she was incontinent, and she was relatively embarrassed about it, but she goes, that's what happens when you've had 6 kids.
Yeah.
And I think for females who are still involved in sport at a high level, and maybe they have had children, or maybe they haven't yet, I don't know that a lot of them are aware of the benefit you can get from seeing a professional that works particularly with pelvic floor issues and incontinence, especially in younger people. I think if you've had a child, the maternal health nurse will talk to you about it, but there are professionals in this realm, and I know you've got a little bit of experience being exposed to that.
Yeah, I mean, I've just been,
as part of your studies,
Yeah, as part of my studies, I did a bit of observation at some women's health clinics, good friends with a women's health physiotherapist in Melbourne. And so I've had the joy of just being able to get some exposure through her, and if I have questions more specific to that, I'll usually give her a call or get her thoughts on it. And I think I just, as a physio, when I was studying physio as well, we do a unit on pregnancy, but you don't learn about sort of all the other complexities of women's health and how that influences musculoskeletal issues. So I think we're not expected to be experts as musc physios in women's health and pelvic floor physio, but I think it's knowing how to screen and make the referrals and know sort of how to make that next step for that client.
Do you think at the moment female athletes are comfortable enough bringing that stuff up? Was it something that was brought up at all?
The athletes I've worked with?
Yeah, in the footy club and things like that. Is something that was being screened or asked about, or was there any sort of open discussion? Because I feel whether you like it or not, the tough culture of footy, I think, persists male or female. And so a lot of them don't want to really admit to things that aren't working.
Yeah.
Was there much discussion around that and making sure that people had been screened? And able to actually okay, I need to navigate this problem, because every time I, do heaps of jumping, I feel like, my bladder's going to be incontinent.
Yeah, I don't think there wasn't any formal kind of procedures that we followed in terms of screening with these sorts of things, but I definitely feel maybe just being in a women's sort of dominated environment, it was definitely, I felt that a lot of athletes did feel comfortable openly discussing it, in the medical rooms and things like that. I found that if I prompted them and asked quite the right questions,
as a general, were there instances of people describing some level of incontinence?
No incontinence that I saw throughout people I've worked with, but I know that is a common symptom.
Yeah, in athletes definitely.
Yeah, for sure. Urinary incontinence is something, and it's often probably one of the more awkward, embarrassing symptoms probably to talk about as well. So by all means, I'm sure there could have probably been someone that was dealing with that whether they discuss it or not. But I think just knowing, just sort of educating them and giving them the options to see the right specialist in this area is important, just for general physios, and just everyone should really know that, really. Because I think just doing some observation at some women's health clinics, it really exposed me to how valuable it can actually be, especially if you are having pelvic floor issues and experiencing incontinence. Or
I guess that's the message for those women listening, that if you're having issues with it, do seek out professionals, because there are opportunities for you to make big change there.
Yeah, for sure. And I think it's just, we have it, as health clinicians, obviously that's the whole thing of, working within your scope of practice. And as a musc physio, we're not, without a women's health master's, in physio, we're not supposed to probably provide certain advice. But I think it's I think this
is a cool thing, us having you here, and this is why we really wanted to get you on the podcast. So obviously you've got more experience working in this environment than particularly, I definitely know that between Jack and I, that's the case. So I think you're a little bit more used to that idea of screening these things and being very aware. So, I think for our listeners and even people that have, some of our clientele, I think it's important that if you're getting some of those kind of things and you think it's maybe related to your performance or your injury profile, that you do discuss that, because we do have links, we do have people that we can set you up with.
Yeah.
And it's kind of nice, you've reminded me actually to make sure that I don't forget to ask some of those things, as awkward as it is.
Well, it also just, as us as clinicians, it can influence like our management as well. Like if you're not asking about their symptoms around their cycle, that can really like affect your management because, you know, ultimately it may not be a superficial muscle that you're dealing with. Yeah. It might be something more internal that actually requires further investigation. And, you know, a lot of the issues, I'm sure there is a large musculoskeletal component and probably something that we can address down the track as well. But I think if you're not making that referral early on, you're probably wasting a lot of time as well.
The thing, the part that I wanted to go on to, because obviously it's something that gets brought up a lot in relation to people who experience increased period pain, is use of oral contraceptives. And the good thing, like having someone like Adam Bryant on, you know, he obviously did that research more than 10 years ago now, looking at oral contraceptive, the oral contraceptive pill and the effect that it has on collagen structures and the ability for it to increase tendon stiffness, and potentially the effect it might have on muscle strain injuries. Is that something that was discussed in the medical environment of whether people were, you know, using some sort of, and you say this, it obviously sounds like we're talking about athletes and stuff behind their back, but it's a really interesting one because there is potentially benefit that comes from using these things, not only for managing, say, hormonal symptoms relating to someone's period, but also musculoskeletally. As we mentioned, there are these hormone receptors that do alter what happens. So, you know, for those who didn't listen to Adam's podcast, go back and have a listen to Adam Bryant on our show. But he basically showed that the risk of, say, tendon injury goes down for females if they are on oral contraceptive pill. And he did research looking at ACL injuries and like the actual stiffness properties of the ACL and these kind of things. So whether it's something that can be used, you know, there was discussion around that, and whether it's prescriptive or not, I don't know. That was, I think, a controversial thing of like whether the team doctor's going, oh, you should go on this because it's going to help your performance or injuries. But was that something that you guys spoke about and with the athlete and with the you know, the medical team?
Unfortunately, probably no. We didn't speak about it enough. We never really spoke specifically of oral contraception. I think it's hard when you're, obviously as a physio as well, I'm not the doctor. So, you know, you want to be like not providing really set advice and prescription to someone.
No, it's not prescriptive. I know, and it's not going to be prescriptive. It's more about asking the questions and then appropriately using the professional medical people.
Yeah. Yeah, no, I don't think we really, like, unfortunately, we probably didn't highlight it enough in our meetings. I don't think we spoke about our menstrual cycles enough, full stop, let alone like oral contraception and different options and things like that. But that is something really interesting. I think it could definitely be something that sports doctors should probably be having discussions with.
It is a big focus, I know, for a lot of sports doctors that I've dealt with. It's one of the first things that they often ask. And it's an interesting interplay because I think there's, you know, I can't comment on this, and maybe you can from personal experience, but like I know that a lot of the athletes I've dealt with, some of them don't actually like taking it because of the other effects it has, whether it's on mood or, you know, how they feel physically or whatever it is. So it's a really interesting one because it's like maybe there are benefits here, but there are downsides.
You're compromising something else. Yeah.
I actually wonder too, how much of it has to do with when you're taking, say, oral contraceptive pill, you're having a lot more stability with your hormones as opposed to the variation that happens periodically.
Yeah.
Because is that one of the bigger risk factors for female athletes is you're constantly having to alter your neuromuscular patterns to make sure you're maintaining enough active stiffness and mitigating injury risk. And if that's more of the problem associated with female athletes and certain injuries.
Yeah, that's really interesting.
Yeah, because, you know, it's an interesting concept, and we've talked about this before, John, in the sense of movement variability is actually protective, but if you're constantly changing your internal environment and tissue mechanics, that can be almost too challenging for the system to actually deal with those fluctuations. Yeah.
I think that's a really important factor because you do see it as like all of a sudden they lose certain properties. And
yeah, it actually makes me think then too, and I don't know enough about this, and I think there's been a lot of research done in it yet, but I know Keith Barr has talked about using certain types of supplements And I know there's certain compounds in soy.
Growth hormone.
Yeah. No, there's certain compounds in soy, and I'm pretty sure there's certain compounds in cocoa that he's played around with that can alter the stiffness of collagen, but also the synthesis of collagen in terms of actually creating more collagen. I wonder if maybe that's an interesting area to look at in the future of how you can help regulate.
The big problem is, and this is the issue that you have is if you create say more collagen stiffness, it does actually mean that muscle tissue has to do more, and so potentially are you changing injury risk on that end?
Well, and look, I'm just speaking, on very little knowledge, but whether you actually take it at certain times, for a female athlete in particular, to help try and regulate tissue properties more consistently throughout the menstrual cycle. I obviously have no idea, but I'm just speculating now as I think about it. But yeah, I mean, there are consequences to taking any type of supplementation in terms of altering your tissue properties that may lead to an increase in performance, but then actually starts to increase injury risk because stiffness becomes too excessive, as an example.
Especially if it's something you're not used to.
Yes, yeah, absolutely.
I think it's an interesting concept, and I think that, as I said, that you've got to find what's right for that individual. It's not. I don't think, as you mentioned before, like if you go off averages, maybe you're going to end up in a position where you're not getting the best outcome for everybody.
Yeah.
One of the things I did want to ask you was, in terms of you dealing with females versus males, given that you've had exposure to maybe some more of those elite females and some of even our other practitioners, do you have a bit of a process that you go through, and do you see them differently? Like, are there things that you have to assess or you have to look at, or you think, I need to view this slightly differently when you're dealing with males versus females? Like, are you profiling them slightly differently?
In terms of the elite sort of category?
Not even an elite, no, I mean like from an injury perspective.
Just going from an assessment standpoint even,
I guess I'm just a lot more in tune with making sure that I'm asking the right questions for females, particularly it depends on really where the injury is as well, and what we're actually dealing with, obviously. But I think for women, I'm always making sure I'm checking in with all those systemic health markers, in terms of around their cycle, making sure you're getting a really clear history. And I think that's where the medication, males and females, I think you want, I follow a very similar sort of process, but I think it's just the questioning is a little bit different, and it's just making sure I'm getting all the information I need to paint a clearer picture, because I think it's interesting. I find that you probably can't muck around with women as much in that sense. If you don't ask those questions early on, you might be running yourself into a bit of a dead end because you're fighting an inevitable battle that you can't win.
So I think you raised a good point though there, Georgie, too, when you think about, say, there are differences obviously in terms of the hormonal profile and fluctuation in men versus women, but you can have a lot of issues with hormones in men as well. But I think the other big one then too that you're alluding to is understanding that there is variation for a woman on a monthly cycle that needs to be taken into consideration, and aligning that with injury risk, or also, like you mentioned before too, whether that is correlated to a change in their symptoms, if they're experiencing more non-specific pain, to think about whether there is an internal component associated with their problem. And
I think I've definitely used it also more in my management, particularly with structuring rehab programs, when we're not dealing with that elite category and they don't have such a timeline they're working towards with a competition.
You can be more flexible with the programming.
Correct. I found that's been really important for facilitating your patient's needs. I found a lot of my best relationships with clients have been the ones that I feel I've respected that, and I think I've noticed that it's really enhanced our relationship, because it's showing I'm a female as well, I get it, and male or female, it's just respecting all those other systemic things is really important as part of programming, and I think we've had some good outcomes as a result. And then just from a performance standpoint, it's I've noticed that you can actually get a lot more out of them in those weeks earlier on in the cycle. I've programming some of the harder sessions then, and then, I guess in some programming, depending on who your patient is and what you're working towards, often you will have, some adaptation weeks in there where you might have a recovery at the end of a block of progressive load, and I think that's a nice time to have that week when they're on their period, and I think that's definitely worked to get some good outcomes. So yeah, I've definitely found myself leaning towards it more in management as well.
Yeah, so your periodization and planning,
correct,
particularly for like we're talking more in the general populace, who are people who might be physically active but don't have specific competitive timelines or to work towards. You can have that flexibility with structuring their programming to take that into consideration.
Yeah, for sure. Yeah.
What about you, Jack? Do you see, based on the characteristics that we find from maybe physical capacity standpoint, differences that you screen for between males and females? Like, is there things that you look at and you go, okay, well, I know typically because of, this being like, for instance, like a silly example might be like flexibility.
Yeah.
I know that, for instance, females on general, and you obviously assess the individual, but like are much more flexible than males. And for that reason, like, I'm often being a little bit more prescriptive to males, being like, you need to do this a lot more often because I know that it's going to take a little bit more time of stimulus and more volume of stimulus to see that change. And vice versa with women, for instance, like they're often typically unable to create, as I said, those active stiffness properties at the same level. So you need to gradually build that up more, maybe have more of an emphasis on that because we know that they don't create that as easily as men, and men maybe don't need as much volume of that. So it's got its pros and cons, but it's like you're kind of using that profile.
The other one I think of too, John, which I think we've spoken about off air, a very common injury, particularly in AFL, is ACL injuries, and more often than not getting a hamstring graft. But thinking about some of the patterns you see in differences in quadriceps versus hamstring dominance in females versus males, and typically being more quad dominant in one of their movement patterns, and having some of the issues associated with having a hamstring graft that further impairs potentially poor hamstring capacity already. I think that's actually a really important one, and a very important one from a rehabilitation standpoint post ACL rupture, if they've had a hamstring graft, of ensuring that there is adequate stimulus to make sure that they're building up the tissue capacity they need through their hamstring to mitigate hamstring strain injuries, but also maximise knee function and knee stabilisation.
I feel like that, so having that in mind, like, does that change the way you assess, an ACL of a male versus a female? And
or maybe just the recommendation that you say to them, speak to your surgeon about. And the surgeons are really good with this now. They really, some of the better ones, like we work obviously closely. We've had, some of the people from Orthosport on, Julia Kirby. I'm trying to get Lachlan Batty on, but we've had a few others. And often these days they'll actually test and they'll go, oh, what's your hamstring strength? What's your quadriceps strength? And they're really, like those guys, as particularly as younger surgeons, and this is not to have got older surgeons, but they seem to be very open to exploring some of this stuff. So it's like you say to them, oh, actually on the testing, they're more quad dominant or they're more hamstring dominant. Maybe they would actually benefit from this graft harvest or whatever. I think it's one of those things of being very aware of that, prior to the surgery, not putting them in a position of maybe enhanced disadvantage.
Further detriment,
Yeah, and I think actually the other one too, is that following ACL injuries, and I'm pretty sure this is correct, males are more likely to strain the same ACL, where females are more likely to strain the opposite. So that highlights to me too the importance of making sure that single leg dominance and single leg biomechanics is developed very effectively on the affected side for a female, because I make the assumption that the unaffected side is the one that becomes injured because it's working harder. So there's definitely, and look, apart from the quads, hamstring, I think the other one too, and this is just as a general profiling of thinking about the proximal quadriceps versus gluteal development. So, you do see certain females who may have a lot of proximal quadriceps development and lack gluteal development. And I think for them, that's the way that they help stabilise through their lateral chain and through their ITB, by creating more quadriceps tension, creating that hydraulic amplifier effect of the ITB versus the gluteal tension that connects directly to the ITB. So you certainly see some patterns that I think are important to take into consideration, because that just gives you a risk profile. But that also varies from individual to individual, I think. So that's really more case by case. But you might see certain types of muscle bulk development that are more common in men versus women.
Any more golden nuggets we want to extract from Georgie's brain before we let her get back to...
Well, maybe is there anything else that you want to enlighten us with, Georgie, that you think that's important to share on the topic?
Trying to think what else John and I have nutted out in the last few hours.
Well, there is one other thing I'd be interested to hear your thoughts on, Georgie. And this, you may not have had direct influence on this, but being involved in conversations, what about things like nutrition? You know, did you see certain nutritional patterns in some of the female athletes that you work with that, like, it might not have been you directly, but maybe say for the sports doc, or whether you had like dietetics involved, of making sure that they maximise their dietary intake, or if they were, say, for instance, not doing that, or they were...
That's a big Pandora's box as well, which is more on making sure they get enough intake, because obviously...
Sure, yeah.
Yeah, well, I think obviously that's something to be really mindful of. Like, we're probably going to dive into a whole other rabbit hole here, but
Sorry, keep going.
Obviously some things that have come up, and I know I've had clients with things like this as well, but like, you've obviously got REDS is quite a prominent thing you see in women.
Sure.
And I feel like there's a lot of, definitely I think it's something to be like really aware of. I think like it's something that we do screen for, particularly in sport, like regardless if you're a dietitian or not, just asking generally about their diet. And you're obviously being there at training, you're seeing what they're eating as well. Their diet is very much controlled, like making sure they're getting enough intake of, carbs, protein, etc. But I think something that obviously you need to keep in mind and be really vigilant of is, their intake, to make sure that we're keeping their bones nice and strong. Obviously we know with women that's something that is a battle you're going to have to face lifelong with.
Sure.
In terms of our bone density. So, I think that's definitely something that, we've had to look out for. But, in terms of, like, from my standpoint, my role I played, I didn't really have much control over the dietetic side of things, but it's definitely questions that I ask athletes, like, what are you eating after games? What are you eating after training? Like,
do you have dietary restrictions or following a particular diet?
Yeah, and like that's obviously something that's important as well. If they are, noting some of those symptoms, I feel really tired today, I, haven't had much energy all week. It's like, that's something you've got to, one of the first and foremost, are you getting enough sleep? Are you eating well? Have you cut out anything in your diet recently? Are you on any particular dietary plan? Like, are you restricting, are you fasting? So I think, they all play a big role, but I don't know. I think this is something that maybe we need to be educated more on, but is like identifying REDs and identifying when maybe people aren't getting enough fuel and how much that's influencing performance. It's not something I'm, super knowledgeable about, but it's something that I think all of us as practitioners should be more aware of. And what's your guys' stance on, I guess, that? And
well, I think you've highlighted it because it's important to understand other non-physical or systemic factors that influence injury risk and also adaptation to training. And certainly diet is clearly a big factor. And I think that's also really important too with understanding that, like, because of menstruation, you are going to have susceptibility to developing certain deficiencies, like iron.
Particularly iron's a big one, isn't it?
A big one in particular. And that has a big influence on things like bioenergetics and therefore how you feel and how you function and perform. So it does have a correlation to your injury risk because of the fact that if you are low in energy, that's going to increase obviously your fatigue and susceptibility to getting an injury.
Yeah, for sure.
One thing I do want to ask as maybe a wrap up is, and usually we let people talk about this in generality, but what's something in women's sport and women's injury world that we're working in that excites you, and something that's interesting that you find like, I'm interested to see where this goes? Is there anything that's kind of like taken your interest at all? Maybe not, but
I think like it's cool to see that. I think if women are provided a more professional environment in the sport, how far they can get in their ability. I think like just obviously it was cool being in a sport that's still up and coming and that they're still developing. I'm definitely I'm very excited to see where the AFLW program goes and actually what the injury rate looks like over time.
Yeah, I think that's going to be super interesting. Like how much does that evolve?
Watching that trend.
You expect it to, but in what direction does it go?
And I think it will give us a better understanding of is it actually at the end of the day, is there still such a large biological element versus the environment. Because at the moment it's hard to tell because there's still so many other variables that we're not sure about because sport hasn't been around long for women. So I think that's something that excites me to see, like, will like the ACL rate drop, like as you'd hope it would.
Yeah, hopefully.
And you expect it, but yeah, it will. I think that'll be interesting to see. That's sort of something, I guess, just with my exposure, something that I'm really intrigued to watch over time for sure.
All right, Georgie, thank you so much for your time. We really
worries.
appreciate you coming on and sharing your insights with us. Thank you very much for listening. And if you ever have questions, as always, feel free to contact us via any of the social media channels or contact the clinic.